we need to have some sort of awareness. And that is where our major sponsor and fund and partner, World Diabetes Foundation, comes in.
Christopher Kwizera, team leader at Uganda Non-Communicable Diseases Alliance, emphasizes that media, being a major tool for communication, must be engaged more comprehensively to better understand non-communicable diseases and improve their reporting on these conditions.
We understand and have realized over time that the media is the biggest tool to channel information, especially for education, to the population and to the entire community of Uganda. But quite often, we realize that there's a lot of inaccuracies when the media is communicating, or when some people are communicating, or there's completely no information reaching down to the people, especially on prevention of non-communicable diseases.
Kwizera adds that media needs to have the concept of NCDs across the country to create more awareness about NCDs risk factors and preventive measures.
So we think and we find it prudent to bring the media people together, take them through the basics of prevention and control of non-communicable diseases, but most importantly, to give them the concepts of NCDs so that whenever they are talking to the population, or when they are relaying their information, they are talking it from an informed point of view. But also most important is that the media personnel or the media practitioners are part of the wider Ugandan population. So as much as we are teaching them to go and teach the population, we are also teaching them for themselves as individuals. And should start with them. Before they teach others, they must also be healthy, and as they communicate, they must communicate with passion of what they know and what they believe.
He revealed that NCDs continue to increase in Uganda and has led to negative impact on the country's economic and social development. NCDs
have a greater impact on the Uganda's economy, not even the economy, but also on the healthcare system of our country. We know that there's an outcry of everyone about the healthcare system. It's already in shambles, but the non-communicable diseases are increasing and they are continually burdening the healthcare system. And if we do nothing, the healthcare system will completely be overwhelmed and be shattered. So we want to ensure that we do a lot of prevention so that NCDs rates are averted, so that we can have a healthcare system serving everyone. And if we do not have healthy people, then our economy will be in trouble.
Kwizera further noted that non-communicable diseases are very expensive in terms of treatment, reason as to why prevention measures is a key, such as physical exercises, stopping tobacco smoking and use of excessive alcohol, ensuring good healthy diet, among others.
These do not have free medicines. Whether you like it, you may have to pay, especially, and even those who are referred outside of the country, they are referred because the conditions are complicated. And for those who need the basic treatment, the supply is always not, the supply is intermittent. It's not that you have continuous supply of medicines that every time you go to a public health facility to get the treatment. They are not available as people would want the services. But besides the medicine, even the healthcare professionals are not adequate to be able to manage infectious and non-infectious diseases. And at the same time, they also have inadequate knowledge in managing some NCDs.
Non-communicable diseases that are common include diabetes, blood pressure, hypertension, cancer, sickle cells, heart diseases, among others. Julius Mhomuza, Church of Uganda Family TV, News at 8.